Hi, in this video we'd like to talk about bed rest being an ineffective approach to dealing with late miscarriages. So we've had a patient recently and we'd like to do a case study and bring more awareness towards this kind of approach, which is where many doctors, many hospitals will recommend bed rest and also very low movement, very low activity to prevent a late miscarriage. Now, we do know that late miscarriages are caused by either cervical insufficiency and short cervix. So these doctors will wrongfully recommend this bed rest approach, which is widely still practiced by many hospitals today, so that they believe that they can prevent this miscarriage from happening. So this patient alone, she's already had a history of 5 late miscarriages just because of this bed rest approach. So we want women to understand more about these approaches and avoid these approaches. Actually seek proper management so that you can actually save your pregnancy and prevent repeated miscarriages, especially when we see patients like this who have 5 late miscarriages that could have been entirely prevented. It is definitely a sad thing to see, but rest assured, she is now going on to a successful pregnancy because she's received the proper treatment. So briefly, I'd like to explain that in her first and second experience of miscarriage, she was recommended bed rest and she was not advised to move too much. So she followed the doctor's advice and she still miscarried, inevitably. And then the doctors also consoled her and recommended that she try again because sometimes these things do happen. However, in her subsequent pregnancies, because of her previous fear and the trauma that she'd experienced in her previous miscarriage, she was still recommended bed rest. However, she is so much in anxiety and fear that she is refusing to move in hopes that she can prevent this pregnancy. Sometimes she says that she blames herself, that she believes that because of her sudden movement she may have caused this miscarriage. But we'd like to explain that your external movement, your external activity plays no role in causing the pregnancy to miscarry or anything. The main reason why your cervical insufficiency, the short cervix, is actually causing some dilation is actually due to the growth of the fetus, and also the activity of the fetus. It is actually an active process. The fetus is actually growing all the time, and there might be some rotation, some kicks in here and there. These are the ones that are actually causing the uterus to actually expand and cause this premature dilation. So no matter how much you control your external activity, even if you stay still for months, which is not recommended because this patient alone, she did that and she experienced muscle atrophy, especially in her both legs, because she was in such a state of fear that she was afraid that she was causing this miscarriage. It has no correlation at all. Your activity, your external activity movements play no role in causing this miscarriage. So the proper way that she was in fact should have done is that first of all, she need to actually increase activity. You need to be as active as possible, especially for patients who are first-time pregnancies and have a history of miscarriages. We here at Antai Hospital always recommend them that you need to develop a healthy, active lifestyle. Do what you need to do. For example, you can still go for a walk, you can still continue doing your exercises, your houseworks, be as active as possible, avoid a sedentary life because we want the circulation to be healthy. It all helps, has all the benefits and no downsides at all. Secondly, the proper approach is that you need to go for surgical management. All we need to do here at Antai Hospital is that we just attach either 1 or 2 anti-cervical ring via 3D laparoscopic surgery before pregnancy will be the best case scenario because you will have an uninterrupted full-term healthy pregnancy. And all we do is that we secure it on the cervix so that it doesn't experience any premature dilation. So some patients will say, what if I've only just found out during pregnancy that I have this condition? Can I still receive this treatment? The answer is, of course you can. We here at Antai Hospital, we have our expertise and experience. We can also conduct this anti-cervical ring procedure during pregnancy. We've been seeing patients with late miscarriages, and with all these ineffective and harmful recommendations, we do want to bring more awareness, let these women who have a history of these miscarriages to go on the correct path and avoid future disappointments and tragedy. So get in touch with us via the website to find out more information, and also do educate yourself more on these ineffective approaches. If you are recommended bed rest as a management method for miscarriage, please quickly seek a new doctor, seek a specialist that is actually knowing what to do in miscarriage prevention and treatment. So get in touch with us via the website, set up an online consultation, let us see how we can help you today.